Stop. Talk to me.
Hi, Grant.
Hey, Crystal.
How are you today?
I'm good. Mostly good.
Good.
These are complicated times.
I agree.
Yeah.
But we're back on Stop and Talk. And who's our guest today?
Well, we're gonna be talking in this episode with Chris Appleton, who is the founder of an entity called Arts Pharmacy. And Chris is a really smart guy who comes out of the nonprofit sector, but he has been devoting himself in recent years to the idea that by using the arts, we can help people address mental health issues in a way that will stand up to the standards and scrutiny of health providers and insurance companies. And the simple idea is just that by using the arts in their fullest and most natural form, we're going to be able to help people feel more connected and more vibrant and more alive and maybe more connected with their own sense of purpose. So it's a really exciting conversation that we're going to have with Chris.
Excellent. So basically, he's presenting the opportunity for me to get a social prescription that's art so I can tend to my needs.
He talks a lot about this idea
Yeah.
of social prescribing.
Okay.
And social prescribing is, your doctor writes you a prescription for medicine.
Love it.
But why can't that medicine be something that cures you or helps you in kind of a natural way? And through gathering with other people, experiencing an art form, maybe even contributing to that art form, and coming alive in a way that the arts can help people do. Now, I want to caution at the front end, he's not suggesting that replaces medicine as we traditionally think of it, but that it is its own kind of medicine that can add to the arsenal of tools that doctors have at their disposal.
Sounds fascinating. Shall we dive in?
I think we should.
Let's do it.
Let's do it. Chris Appleton, thank you so much for joining us.
Grant, thanks so much for having me today.
It is a real pleasure. This is kind of a new departure for us with bringing someone onto the program who has been not a local grantee in the community yet, although I think there are plenty of people who are pulling to have your work and your influence be woven through San Diego more. But somebody who started off your iteration with us as kind of an inspiration for our work. And, we just announced a major initiative for the foundation called Healing Through Nature and Arts, which was in no small part inspired by Arts Pharmacy and the work that you have done to look differently at the role of art and, by extension, nature into the world of wellness and healing. And that's what we're going to talk about today is how that came to be for you, what your original interest in it was. And I'm just going to dive in, if that's okay, with some questions about that and your journey and what it's made you realize and insights that you've had along the way. Sound good?
It sounds great. I look forward to the conversation.
Yeah.
Thanks for having me today.
Yeah, likewise. Well, let's start at the beginning, at least of this journey for you. You started two nonprofits before you started Arts Pharmacy. And maybe we should just start by explaining to people from your perspective what Arts Pharmacy is, and then we'll talk about how you got there.
Sure. Art Pharmacy is a social prescribing company. We're based in Atlanta, but we work nationally. Social prescribing, maybe we should explain that a little bit.
Yeah,
is
please
the
do.
Practice, the practice through which healthcare providers refer their patients or clients to non-clinical community supports. And Art Pharmacy is a company that enables that for healthcare providers, for health systems, for community-based organizations, all in service, Grant, you've mentioned, of leveraging the healing power of arts, culture, and creativity to improve individual and community health.
So let's talk a little bit about then. And by the way, I'm sorry that I kept pluralizing arts, but I think of it as art. So, but in your name, it's Art Pharmacy. Tell us a little bit about how you came to focus on that. You know, how you got the idea for social prescribing, and your journey in the nonprofit space before that helped you get there.
I had built a career when I was in college. Two friends and I started a small arts and community development organization that was a college project that became a thing, and I ended up running for about 15 years until 2019. And through that work, it was really about integrating arts and culture into civic life, community development issues related to transit and housing. Through that work, was introduced to the arts and medicine field, and came to discover, certainly I had witnessed through the work and witnessed in my own life the healing power of the arts, but came to discover through the arts and medicine or arts and health research field, there's just an abundance of evidence that demonstrates that arts participation, arts engagement can improve people's health outcomes. And it was, like every good social entrepreneur, odd to me that the U.S. healthcare system hadn't bought the arts, at scale. And so, the asking of why why hasn't the system adopted the arts and really embraced the arts at scale is the beginning question that led to the development of Art Pharmacy.
I have to ask, what was your answer to that question about why they hadn't? Was it, if there was an abundance of evidence, the cynic in me would say it's because you can't patent or trademark it, and also it feels soft in a field that tends to adhere to hard medicine, and drugs as solutions, and the concept of healing. Is that what was the primary factor in your discovery?
The science is actually pretty strong. So, and not just soft science, hard science. I mean, we know that engaging in the arts can reduce cortisol levels, can have positive impacts on heart rate and blood pressure, supports the immune system, improve brain function. We know these things. The unfortunate truth in the U.S. healthcare system is that it's not only about can it improve clinical outcomes? Not only is it about can it improve people's health, but also does it reduce total cost of care? Is it less expensive than other interventions? Does it reduce the unnecessary utilization of other healthcare services? And that is a piece that the arts and health research field has not yet really tackled. So it's done a good job of tackling, does this improve people's health? We always need more, but right. We don't have challenges convincing physicians, health plan executives, policymakers. We don't have challenges convincing them that it can have a positive impact on people's health. Where there's still needed more evidence is on the economic benefit, not to society. I think we talk a lot about the economic benefits of the arts to society, the economic impact, but can it really deliver to the bottom line of third-party payers, Centers for Medicare and Medicaid Services, and private health plans?
So that was the notion with Art Pharmacy, was that you would intervene at that level and try and really get this concept built into the core system of U.S. healthcare. Correct?
That's exactly right. That's what we are. That's what we're trying to do. It's very hard work, but we're making some progress.
How does it fly with the notion of social prescribing? How does it fly with patients in your experience? Is it
we cannot keep up? We cannot keep up with patient demand.
Seriously, say more.
People are hungry for connection. People are hungry for belonging. There is a mental health crisis in America. There is a social isolation and loneliness crisis in America. There are not enough available mental health supports. The time to care for somebody, especially on individual Medicaid, Medicare plans. The time to care, to get an appointment, to see a therapist is long. And there's still a lot of stigma for some communities around seeking mental health support. And social prescribing is a less stigmatized, more available, more affordable, as effective intervention, more culturally responsive, more culturally accessible intervention for people who are looking for alternatives.
Beautiful. Can you share some examples of people who you've seen this work for? Are there particularly compelling stories that help you illustrate this when you're talking about it, so that it comes alive for people who are hearing about it for the first time?
There's a story that I got just yesterday, so this will be my first time telling this story because it just happened this past weekend.
Yeah.
But we, one of the places where we work is in rural Massachusetts. And we work with a health plan there that refers members to us that are Medicaid, Medicare members. They're older adults that are also economically vulnerable, that have some risk factors for social isolation and loneliness and chronic disease. An individual was referred to us, and this is an older man, and he got connected to a theater in this small town that he lives. Went to that theater performance, but as a part of going out to that performance, I think it was on Friday evening. As a part of going out to that performance Friday evening, also went out to dinner, and came back to us and said, I didn't know, I hadn't left my house. I didn't know all these resources, the cultural vibrancy of this community that I live in. So not only is this social prescription providing me direct access to these very specific activities that Art Pharmacy is referring the individual to, but also opening him up to awareness of the other resources and assets that are in his community.
Love that story. In an example like that, instead of being prescribed therapy, and I want to talk about therapy in a moment, but instead of being prescribed therapy, he's being prescribed art. And in your model, in the old model, the therapy model, somebody pays for, or theoretically helps pay for the therapist and the counseling. In this model, is somebody paying for the arts experience?
That's exactly right. So in our model, not only does the individual, this older adult, this man, not only does he not have to pay to attend the theater, we also provided him with companion participation. So he was able to go with a friend, and we paid the theater for that. And we're paid by the health plan, by a third party payer.
That's brilliant. It's such an important innovation. I'm curious, as we have rolled out our program in San Diego and been talking about this and trying to build a broader base of support for this work here. One of the things that I've really been thinking a lot about is how we talk about this versus where we started, which was the clinical treatment and therapy model. And, we started with that because we were created right in the middle of this mental health crisis and, the epidemic of loneliness, the epidemic of disconnection. Everywhere we looked in terms of the challenges facing young people, it surfaced and it was clear. And what we kept hearing from traditional healthcare providers was, we are overwhelmed. We can't keep up. You literally cannot hire enough therapists. There aren't enough people to play the roles. And then, but we tried. We gave it the old college try and funded some of that. And I think good things happened as a result. Certainly some people got access that otherwise might not have to those traditional services. But then we started looking around at the basic evidence of what's going on in society. So if the utilization of therapists is on an exponential growth curve, and the crisis of mental health is on an even larger exponential growth curve, you have to at some point ask, is that the solution to this problem? And as we've looked at this program here, we want to be respectful of, because we think there's a place for traditional therapy in this. But we also think there needs to be something else that is disruptive and preventative added to the system. How do you talk about the relationship between a solution like social prescribing and the traditional model of therapy?
We think about social prescribing along an acuity continuum.
Mm-hmm.
So social prescribing can and should be a true prevention methodology. Social prescribing can and should be an early intervention for people that are perhaps subclinical, don't yet have a diagnosis of a depression disorder or an anxiety disorder, but maybe don't yet need to be seeing a therapist every week or every 2 weeks. And then social prescribing is also an adjunct and a complementary support to individuals with more serious and persistent mental illness that are in the care of a behavioral health provider. So it's really across the continuum. The challenge in, being social prescribing, being all of those things is, well, those are three very different populations.
Right.
Those are three very different payers. Those are three very different ways of serving people. And so, organizations and programs that are delivering social prescribing need to really think about where they fit in, or if they have multiple, ways of doing it, to be really clear about population selection, cohort selection. What is the goal? Back to an earlier question that you had regarding, what's the reason that U.S. healthcare hasn't bought it? One of the challenges in U.S. healthcare is the lack of incentives for prevention.
Mm-hmm.
Right? We enter into 12-month contracts with our health plans.
Right.
Well, prevention's not really about saving money within a 12-month contract period. Prevention is about saving money further down the road. And so why should a health plan pay for something today when maybe I'm not going to be on that health plan in 13 months when the cost savings shows up? And so thinking about those incentive structures that exist and making sure the right parties are at the table, and everyone sort of knows what they're working towards. Are we looking to prevent, or are we looking to intervene and hopefully mitigate later more acute effects of a mental health disorder?
It's such a helpful answer, and I really actually a complex answer, but I think a couple of takeaways for me are, first of all, in terms of the therapy versus social prescribing quandary that I raised. What you're saying is they're on a continuum. It's not either or. It can be complementary, both and, sort of depending on which population and which challenge you're looking at, correct?
Very much so.
And then the second thing I took away from that answer was, and we have to look at the way the system is set up, where it disadvantages any investment in prevention because, there are short-term contracts that get reassessed every year. We actually have different payment streams for different populations under different circumstances. How do you navigate that when really it feels like there ought to be a part of art pharmacy that is focused on policy advocacy? And I think there is, and you as a spokesperson and leader. But how do you navigate that?
Well, we try to work in partnership with other organizations that are, much more well-resourced than us and have been doing advocacy for a long time in this space. I mean, there's some great organizations, the National initiative around social isolation and loneliness. The Foundation for Social Connection is doing really great work. There's an emerging organization called Social Prescribing USA that's really trying to kind of be that advocacy, that grassroots advocacy organization. So much of the work has to happen in partnership and shoulder to shoulder with others. And social prescribing may sound new, but I think so important to acknowledge, as evidenced by the 59 grantees that you all just support.
Right.
Made an announcement that this work has been happening for a really, really long time. We're talking about it as though it's new, and maybe some of the way it's being framed and talked about is new. But artists have been healers since the beginning of humankind. People have been using nature to heal since the beginning of humankind, and doctors and health systems have been doing community referral for hundreds of years. It's just that those two fields, right, the arts and culture field and the healthcare field, are ill-equipped to work with one another. So we need better infrastructure to make it easier for them to do so.
I really so appreciate you pointing that out. It was something that leapt to the fore for us as we began to talk about this, that there's a lot of ancient wisdom on the idea of creativity being a way of remaining connected and well, and of being out in nature being a way of remaining connected and well, and combating depression and isolation. So you're right. This goes way back, and I think maybe it would be helpful for our audience just to hear a little bit more about why you think it works. What is when we talk about the gentleman, for example, the story that you shared with me, discovering the vibrancy of his downtown. So he has this isolated experience where he feels good for a moment, and that's a great thing. But how does that become a deeper experience that helps him achieve a new level of wellness in his life? We had a terrific experience in launching the 59 grantees and the $5.2 million initiative that we did yesterday in Healing Through Nature and the Arts, where I happened to be present at one of our groups as we were rolling this out, and they absolutely insisted that we all start dancing with them on stage as they were playing instruments and sort of teaching us this musical genre, which that was scary for me because it forced me again. But I noticed that the level of energy in the room, say there were 25 people in the room, the level of energy in the room at the beginning was, what you would expect when everybody's coming together in a strange environment, and it's a meeting, and meetings are deadly, and everybody's suspicious and wondering what they're going to experience and what they're going to have to do. By the end, everybody's laughing and talking and chatting and connected. So again, you can see, we all see it every day. I mean, we see experiences, but why do you think this works, and what does it take to have it work over a sustained period of time?
Those two last questions are so crucial. Why does the specific activity work, and then what is the longitudinal durational benefit of it, and how do we make sure that there is that durational benefit? I think to the first part of why it works is a few things. We do know that there are physiological things that happen in our body when we engage in creativity, and those benefits depend on what the activity is, whether it's dance or painting or a receptive experience of listening to music. So there's physiological benefit. There's also a great deal of power in having shared emotional experiences with others. It helps us feel connected to one another. You don't have to be talking to them. You could be sitting shoulder to shoulder, watching the same movie, watching the same play, have different perspectives on what is happening, but both having an emotional experience, and therefore we're better bonded to one another. And I think that that's a really powerful component of it. Arts and culture spaces create space for social connection and dialogue, and belonging. I think to the longitudinal, sort of longer term, how does it
Right.
how do we make it stick? I think that's really important. I think that's one of the foundational pieces of research that informed our model. It's a study by Dr. Daisy Fancourt out of the University College London. It's a longitudinal study, I think 8,500 participants, that shows that regular engagement in the arts, not every day, not every week, but a handful of times a year, is really crucial to reducing loneliness, boosting connection and belonging. And so in designing social prescribing programs, grantees or other organizations out there really ought to think about, it's not just one dose that we're providing people, but we ought to be providing multiple doses. And there's got to be a mechanism to connect that first dose to the second dose, and the second to the third, and the third to the fourth, and tying it to people's health goals or whatever aspirations they have for themselves. And that is, really needed to integrate the healing power of arts and nature into long-term health gains for the participant.
And do you buy? I mean, I know you focused primarily on art and cultural experiences. I guess really just arts experiences. Do you buy the idea that this works as well with experiences in nature as much as it does with the arts?
There's plenty of evidence to show that engaging in nature it is extremely beneficial. I'll speak for myself. Some of the time that I feel best is in nature. I spend a lot of time, try to spend a lot of time in nature. We do have programs that are more cultural experiences. So, botanical gardens are some of our partners, and then we do have some nature-based programming that's a part of our network. One of the advantages that the arts have relative to nature is something to do, I think, actually with accountability. There's an art class at 2 p.m. on Saturday at the local community arts center.
Good point.
And so we're able to say to the patient, you've got an appointment at 2 p.m. on Saturday at this venue. And there's going to be someone there. There's going to be someone there to receive you as you show up for your appointment, like you may for a therapist or some other kind of appointment. Some of that exists in the nature programming, but other times it can be, here's the directions to your local park, here's directions to this, outdoor activity, but it's going to be totally self-guided and on your own. And for individuals that are struggling, that are lonely, that, that accountability is a challenge for them, that, other barriers exist. It's many times why they're seeking out, these types of resources. It may be a challenge.
Yeah. So something that is, it's a really good point. So something that is purely self-directed, maybe more of a challenge. And yeah, nature's there all the time, or we like to think it is. So, sometimes we need to steward it better to make sure that it will continue to be. But that's a subject of a different podcast. I'm curious, since you mentioned accountability, I'll ask this question now. How do you think about, because you have to, you're working with some of the toughest business clientele in the world, how do you talk about accountability at the level of delivering value through social prescribing? What are the metrics that you use and that you point to when you're having a conversation with somebody that goes beyond a study of efficacy in theory, but now looks at efficacy in the actual practices applied as part of their business?
We think about process measures. So can you get people to enroll and participate, right? If we get an eligibility file of 10,000 members in health plan XYZ, can we actually get people to engage and participate? So there's some process measures that we think about. Then there are the health outcomes that we measure. We get baseline data on our members. We're using things like the UCLA loneliness index, the PHQ ADS, which are standard tools for measuring depression and anxiety, the WHO5, which is a well-being index. We get that data at intake. And then after each dose, we're measuring the efficacy of that dose. So we're able to see changes over time and the dose response for members. So that's the second big bucket is, what is the impact on the members' mental health and well-being? And then the third is really around healthcare utilization. And, can we prevent emergency department visits where there may be opportunities to do so? Can we strengthen the relationship between the patient and their primary care provider, right? We know when someone has a strong relationship with their primary care provider, that they're going to engage more in preventative services. Can we reduce total cost of care, right? So those are the things. We measure those things with our partners. We report to our partners on those things every month. So, it is because what we are doing is in some ways novel. We talked about it in how other ways it's not novel, right? But because of what we're doing is in some ways novel, and the incentive structures here are very complicated and maybe oftentimes not favorable to more preventative care. Being rigorous on the measurement and reporting is necessary for to make the partnerships that you're speaking to.
Chris, when you talk about those measures, and it's a terrific set of measures that you have and very clear, and I imagine you list them with ease, but I imagine they're not easy to track or inexpensive to track. As you're talking to a growing, cadre, I think it's still early, but a growing cadre of nonprofits and foundations here and elsewhere that are interested in this work, what's your advice to them about measurement and how to prove the efficacy of the model?
To have all the four key stakeholders, the patients, the prescribing partners, the cultural, arts organizations or nature organizations, and the third-party payer at the table together early on. And I think philanthropy has a really important role to play in this. That it's there's of course an exception always, but the health plan is unlikely to pay for it until there's more evidence in San Diego, or Imperial County, local to that community. And so as a result, they often don't get invited to the table to set some of those success metrics early on.
Right.
They have the data, and philanthropy can play a role in being the third party payer while also bringing the health plan and health system to the table to set those clear metrics that need to be measured over time.
Brilliant. Thank you. We'll heed that advice. Appreciate it.
I think you already are.
Well, as I said, the design of our Healing Through Art and Nature was so inspired by what you've done. I think I just want to keep acknowledging that you have been a groundbreaker. And although there is a lot of ancient wisdom here, and you were kind to say, hey, the model isn't new, it is a brave thing to take something that seems intuitively obviously true and has been around for a long time, but is totally and completely ignored as part of the establishment and the practices of our modern era. So I just think it deserves to be said that even though you might be diminishing the originality of it or the innovativeness of it, it's very innovative and original.
Grant, thank you for saying that. We've got a wonderful partner in Massachusetts, Eric Holmgren, who works for the Mass Cultural Council. And Eric opens sort of every discussion about social prescribing. He does this so well. I'll butcher it, but he opens every discussion. He says, the only thing simple about social prescribing is the concept of social prescribing. It sounds, just as you said, right? It sounds so simple and so easy. But actually doing it is really, really hard.
So interesting. Well, when I want to take us back for a moment to the broader concept of what we're trying to do through social prescribing. And as I was listening to you, as I was listening to you talk about the benefits for individuals, it also struck me, it is not only individuals who suffer from a crisis of loneliness in America, it's society itself. We are living through an era where there's this incredible partisanship, incredible divisions in society, social media algorithms that drive us to maybe see each other in the most nefarious ways possible. And people are being, in a way, driven apart from each other. And they're not experiencing naturally, in the way that they might once have, being outdoors, engaging with nature, or engaging with the arts. And so, yes, it hurts them as individuals, but it also produces what we're seeing in the larger society. And I wonder, do you ever think about the work you're doing as a social cure as well as an individual health cure? Or does that feel too grandiose for the level at which you're trying to work?
I hope we are. I hope we're making some small impact. What you're sharing makes me think of what the outgoing U.S. Surgeon General Vivek Murthy shared just last week as his parting prescription for America was community, and spoke just to the issue that you're speaking to. Is it's not just this individual disconnection that we feel. It is a societal disconnection, and you get the Surgeon General's parting prescription isn't injection for a weight loss drug. It is it's a prescription for community, and that is definitely what we need more of.
It is that actually was a pretty powerful statement. You're right, and it's why it's what came up for me as I was hearing you talk, because if we are getting people to address their own wellness issues through experiences of connection with the arts and nature, then maybe we're doing something good for the larger society that they're a part of as well. Feels like that should be true. A lot harder to measure, by the way, but maybe that's something we can work on and be helpful with. I'm curious, as we've talked about these programs, Chris, are there any particular programs that Art Pharmacy recommends that we should talk about as part of this?
I love this question because it's happening all over the world, all over the country. People are doing great work. There are some research centers and research labs that I think people should know about, whether it's to support that work or just to learn from it. Right, they're producing research. It's a repository of wonderful information. A few that come to mind are the NeuroArts Lab at Johns Hopkins. Susan Mag-Salmon co-authored a book with Ivy Ross of Google last year called Your Brain on Art. That's really about neuroaesthetics. That's that work coming out of Hopkins that Susan's leading. People should definitely be aware of. The University of Florida Center for Arts and Medicine, I always sort of talk about as, being kind of the center of the arts and health universe. The work that Jill Sonke pioneered at University of Florida is incredible. The Jameel Arts and Health Lab, which is a collaboration of at NYU, the World Health Organization, Community Jameel, Culture Runners, many other folks are a part of that work. There's great work going on at UCLA. There's multidisciplinary and transdisciplinary research labs. I think are great places for people to look. And while I have been, I think in some ways today, speaking to a particular lens on social prescribing that we've got a lot of conviction about,
right.
A certain way that we ought to be doing it. There's no wrong way to be doing it. There's no wrong way to do this work.
In a way, you kind of just answered the question I wanted to ask you next, but I'm going to ask anyway because you might have a slightly different answer, which is, who are your heroes doing out there in the world who are either supporting what you're doing or adding to the work? I assume that the folks you just mentioned are all on that list, but who else would you name?
I'm inspired by our team every day. Our team at Art Pharmacy, that they are mission-driven people. You don't do this work unless nobody's doing it because they're getting rich. Nobody's doing it because it's easy.
Yeah.
Everyone's doing it because they care deeply about both the impact that we have on individuals, and Grant, as you spoke to earlier, hopefully leaving a little something behind for others too.
Yeah. I want to bring this back to you for a moment before we zoom back out to close out. But you have this interesting background, and it didn't start off in the health space per se. If I have my background info on you correct, you were involved in voter participation, and sort of the more generic type of interest that we would see in the social advocacy space. How does this work feel complementary to you?
It does. I think of, there's a long answer to this question. I'll try to give the really condensed.
Give the best answer. Don't worry about the length.
Yeah, resources show up to different kinds of organizations differently, and I think we have a long history in the United States of philanthropic resources showing up to support the vital, life-giving, healing kinds of programs that so many wonderful artists, arts and nature organizations, community organizations, and those resources need to be more, and we need it more frequently. Absolutely. We have not had the industry resources show up to support the same individuals those programs that we're speaking about are supporting, and so what we're doing at Art Pharmacy. I went back to business school a few years ago to be a little better equipped to try to bring additional resources to support individuals and communities that otherwise lacked access to these vital programs.
That's commitment, by the way, taking yourself back to basics to learn how to do it differently and right. Good for you. It's admirable. What would you say are your top 2 or 3 goals for Art Pharmacy in the next 5 years?
My number one goal for Art Pharmacy over the next, not 5 years, but over the next 3 years, is for Art Pharmacy to be delivering services to members in all 50 states.
Oh wow! Okay.
That is a huge priority for us. And in order to accomplish that, and this is the second goal, to have irrefutable evidence that the arts deliver the outcomes that are required for all 4 stakeholders in that scheme that we talked about earlier, that social prescribing delivers the results that everybody needs.
That's fantastic. I guess I should turn the last couple of minutes over to you to ask you, what you hope our listeners will take away from this conversation. I know you're a busy guy, and taking time out of your schedule to speak about the work is part of how you view your job, but it is also, takes you away from doing that job. So, what do you hope our listeners and viewers will think about this conversation and learn from it?
I hope that while I'm sure there's a huge listenership for this podcast, um, it's still um, relatively small to whoever's watching, primetime news or
I can promise you it is.
television
Yes.
today. And if you're listening to this podcast, you're doing the right thing. Not by listening to this podcast, though. Yes, you're doing the right thing by listening to this podcast. But if you're listening to this podcast, have faith in the work that you are doing and that the organizations and people that you're working with are doing. You don't end up in doing this kind of work for the wrong reasons. So that is one thing I hope people know. It is hard to sometimes it can be hard to sustain the energy that is required to do this longitudinal work, this generational work, right? Like we're trying to bring into an existence new ideas, new models, new ways of paying for things. And that is really, really hard work to do. And so just know you're doing the right work. The second thing that I hope people hear is that there are a lot of other people that want to do it with you. Invite them to your tables, show up to their tables. Maybe another, and this has been a lesson for me as a career nonprofit executive turned social entrepreneur founder, is that the private sector isn't waiting. The private sector is acting much more quickly than the nonprofit sector and the social sector, and it may be counterintuitive, but if you got a good idea that just might work, do it. Go for it. Be mindful, be considerate, be thoughtful, ask the right questions, but take action. Don't be afraid to take action.
I love both of those bits of advice, and I was going to ask you if you have any parting thoughts for the 59 organizations in San Diego that are part of our Healing Through initiative. And what I just heard you say was understand that it may be hard, but you're doing the right work. And if you have a good idea, act on it, and don't stand on ceremony or wait for permission, but get going. Anything you'd like to add to the folks in San Diego?
Just that we hope to be out there with you sometime soon.
Chris, I just want to say what a pleasure this conversation was. I can see why you're making headway in this work. You bring a lot of passion and a lot of knowledge to it. I appreciate what you're trying to do, and I really do believe that what you're doing is an antidote to what ails us at a lot of levels, just as I believe that the 59 organizations here in San Diego and everybody else who maybe isn't part of this program but is thinking about doing this work or is engaged in it somehow else in another way, really tapping into the desire that people have for creativity and flow and to bring things into the world and to be connected with each other and awe and wonder. Just saying the words makes us feel good. So why would engaging in it not? So I just want to say thank you very much for doing the podcast, obviously. More importantly, for doing the work and being a leader nationally on something that I think we really need to be paying attention to.
Well, Grant, that's really kind to say, especially coming from you with just the incredible career and impact that you have had nationally means a lot to me. So thank you.
Thank you. All right. We'll be talking more. Thanks, Chris.
Thank you.
Okay.
That was a very interesting interview.
There was a lot there. And, we are, I at least am sitting with a few thoughts about this, which is that, in between when we spoke with Chris and now when you and I are talking about this, a lot has happened on the science front. And I just want to say at the front end that investments in science of all kinds matter hugely. Mm-hmm. And the more we invest, the more we learn about what works and doesn't work. And what the work that Chris is doing is a fruit of a lot of that research, where we're learning about different ways of approaching really thorny challenges for our society. That's one thought I'm sitting with. Another thought I'm sitting with is that in the work we've been doing with youth mental health and with mental health generally and community wellness, part of what we're seeing is that the model that depends on therapy and treating people after the fact is so limited in terms of the capacity of society to provide those services at scale and to actually help address the underlying causes. And what's exciting about Chris's work is that it does point a way to how we can start investing in a culture and a community that builds mental health and people who are better off simply because we're connected with new and different ideas in each other.
Yeah. And to build on that, I think it's not just that he's built it out. We know we live in an economic model that has health insurance companies, no matter how people feel about them. But he's built out a model that's starting to work with health insurance groups that makes it easier for nonprofits to engage, these tiny little nonprofits who are offering a service or a chance to go to the theater. And he's building out an economic model that works for our current systems.
Yeah, I think this is so key, and thanks for going there, because what he is proving through his model is that there is economic value to this for healthcare systems and for health insurance companies. And, that's the way our healthcare system gets paid for, so it has to be paid attention to. And he is demonstrating that if you connect people with arts opportunities, it will actually help them in terms of managing healthcare costs and obviously insurance payments coming from that.
Exactly.
So wouldn't it be better to invest in these preventive activities at the front end and save money and potentially save lives?
Yeah. So it's good for the economy. It's good for, whether you have Alzheimer's or the story he shared about the gentleman getting back out into community and realizing there was more. And it seems like there's the physical benefits, right? You're getting engaged, your mind is working more, but then there's the benefit of, it feels like working through issues in real time, right? We're engaging with folks at dinner, talking to folks, or even the example you shared about going out to Via International, right?
Right. Yeah. I think it probably isn't a mystery about how this works, right? There have been studies, though, that have documented that it works. And we know a fair bit about the science of it now, that experiencing arts activities and events, and also, as we're discovering through our own programs on nature as well, that nature can have the same impact, that it helps increase the neuroplasticity of the brain. It helps increase the sense of connection we have with awe and wonder and something divine in the universe, with each other. It gives us a deep appreciation of what community is about, makes us feel connected to that. It has all these immense payoffs that on the surface maybe we take for granted. And I think we should pause for a moment and think about the society we're living in and why all of that is so valuable. Most of us these days, I myself included, spend a disproportionate amount of our time staring at this little screen. And we're scrolling all the time on, through story after story that tells us about how awful other people are, and makes us feel not like we're in community. It's such a lie to call that community. It makes it feel like we're disconnected from the rest of the world. And talk about a paranoia machine. And what comes out through the arts is you get challenged with new ideas. You have a moment to think about them. You get to process that. You get to do it in community with others. It's just a wholly different and restorative experience. So when I think about it, it seems so obvious, and yet we struggle with the idea that that is somehow curative. Of course it's curative.
And to go further, to build on what you just said, so we know San Diego is a strong arts and culture economic market, right? We have so much talent here, whether it's poets, theater, and like you said, we also have the outdoor resources, right? I've participated in plays that have been out at Mission Trails or something like that, right? So it's, why wouldn't we take advantage?
A very popular hiking destination.
Which we love, as a new grantee.
All right.
But, there's all these resources that are here that they're given. We don't have to build anything else. They're already here. So why not take advantage of that in a time where, sometimes healthcare is hard to get. Right. And don't get me wrong, those of us who have therapists, we love it, we need it. Right. But there's also this element of supporting one another that now we're being told also just makes good economic sense. So why wouldn't we invest in this?
Well, and you just said many things that were important, but one is this is not an either or, in terms of the clinical model versus a preventive model rooted in art or rooted in nature. It is taking advantage of both, but acknowledging that there is this powerful resource available to us all. And it is. In this community, it's widely available because of the arts assets that you talked about and the natural assets that exist in abundance in this area. It's fascinating for us as a foundation because our areas of work are arts and culture, which many of the folks who are listening to this podcast or watching it are involved with. Medical research, which is about finding new ways of treating and addressing illness, and then healthcare itself and how we treat people once they're finding that they need to be treated. And I think it is just such an eye-opener in a way that it maybe shouldn't be, to realize that these other resources that exist in abundance around us can be helpful in improving the overall picture of human health and community well-being. It's a wonderful gift, actually. So what Chris was really pointing to is how to put a structure around all of that and make it something that we are willing in this society of ours to add value to or to ascribe value to and to compensate people for taking advantage of it.
Yeah, that feels right. And I think whether we approach it from a scarcity mindset or an abundance mindset, right? Scarcity, we know that sometimes healthcare systems are stretched thin. Sometimes it's hard to get resources. So if you want to look at it from that angle, these are additional resources to build upon. From an abundance mindset, it's like we feel so much better. So there's the hard science and facts that point to this as an important thing. But then, as we know, because you just spoke at Creative Mornings to tie things together, right?
I did, yeah.
There's like a bunch of artists, hundreds of artists that do all kinds of different things in our communities, whether it's like our co-producer, Adam, who has a bubblegum machine that has poetry in it, right? All these things add up to our well-being and our feeling good. But being able to go forward, I think, and contribute more. And so I think the more we can get legislators to take this seriously, the more we can help healthcare systems see it's possible. That builds the San Diego that I want to live in,
Well, and I think what you're pointing to there is a really important point for us maybe to end on, which is that it's not just a recent phenomenon, that the way we've been talking to each other as a culture has been really negative about what the future looks like. So everything is dystopian and everything is scary and doom is lurking around every corner. And, because it often feels that way in modern life because things are sometimes feeling so out of control. But we have to tell stories of connection and possibility. It is the only antidote to that will work in the end. And it's not just artists and culture bearers who can carry that message. As it turns out, it's healthcare providers and it's medical researchers. It's certainly people who are working with young people, like many of our grantees are. I think the responsibility we all have right now is to lean into what that looks like and to build that world, because no one's going to build it for us.
Agreed. And I think in the meantime, I'd encourage all of our Stop and Talkers, that's your new name, to do is start to practice this, right? I had gone on a work trip last year where I had a chance to watercolor. So I doodle almost every other night. Someone, I think our vice president said of program, told us, hey, here's some research that shows if you doodle, even if it's bad doodles, it may extend your life 10 years. I'm like, I'm all in. So I have all my little doodles, my avocados and stuff. And I'm sure you're writing poems all the time, right?
I am a lot. Yeah,
Good.
Yeah.
Yeah. So,
by the way, I want to commend you on your choice of outfits for today.
I love your outfit too.
Yeah. It's
yeah.
All right. Well, it's a pleasure doing this with you as always. Thank you
likewise.
For being a fellow traveler on these important issues.
Thank you, Grant, and thank you, Stop and Talkers.
Yeah.
Take care.
Stop. Talk to me.